Welcome to aminacademy.com in human anatomy and physiology regarding cardiovascular system. Let us discuss about cardiac cycle. What is cardiac cycle? At rest, the healthy adult heart is likely to beat at a rate of 60 to 80 beats per minute (bpm). During each heartbeat or cardiac cycle, the heart contracts systole and then relaxes diastole. Stages of cardiac cycle. Taking 74 bpm as an example, each cycle lasts about zero point 0.8 of second and consists of atrial systole, contraction of the atria, ventricular systole, contraction of the ventricles, complete cardiac diastole, relaxation of the atria and ventricles. It does not matter at which stage of the cardiac cycle a description starts. For convenience, the period when the atria are filling has been chosen. The superior vena cava and the inferior vena cava transport deoxygenated blood into the right atrium at the same time as the four pulmonary veins bring oxygenated blood into the left atrium. The anteroventricular valves are open and blood flows passively through the ventricles. The SA node triggers a wave of contraction that spreads over the myocardium of both atria, emptying the atria and completing ventricular filling. After contraction of the ventricles, there is a complete cardiac diastole, a period of 0.4 seconds when atria and ventricles are relaxed. During this time, the myocardium recovers ready for the next heartbeat and the atria refill ready for the next cycle. Now, next we'll talk about heart sound. What is heart sound? The individual is not usually conscious of their heartbeat, but if the ear or the diaphragm of a stethoscope is placed on the chest wall a little below the left nipple, slightly nearer the middle line of heartbeat can be heard. There are four heart sounds, each corresponding to a particular event in the cardiac cycle. The first two are most easily distinguished and sounds through the stethoscope like lub tub. The first sound, lub, is fairly loud and is due to the closure of the atrioventricular valves. This corresponds with the start of ventricular systole. The second sound, dub, is softer and due to the closure of the aortic and pulmonary valves. This corresponds with the ventricular diastole. Electrical charges in the heart. The body tissues and fluids conduct electricity well. So the electrical activity in the heart can be recorded on the skin surface using electrodes positioned on the limbs and or the chest. This recording, called the electrocardiogram, that is ECG, shows the spread of the electrical signal generated by the SA node as it travels through the atria, the AV node, and the ventricles. The normal ECG tracing shows 5 waves, which by convention have been named PQRST. What is cardiac output? The cardiac output is the amount of blood ejected from each ventricle every minute. The amounts expelled by each contraction of each ventricle is the stroke volume. Cardiac output is expressed in liters per minute. and is calculated by multiplying the stroke volume by the heart rate measured by beats per minute. What is beats per minute? Cardiac output is equal to stroke volume into heart rate. What is stroke volume? The stroke volume is determined by the volume of blood in the ventricles immediately before they contract. Now, let us discuss further about these topics. What is cardiac cycle? Look at here, this is a cardiac cycle. The cardiac cycle is the sequence of events that occur during one complete heartbeat. This is a cardiac cycle, encompassing both the contraction systole and relaxation diastole phases of the heart. It involves the coordinated contraction and relaxation of the atria and ventricles, enabling the heart to pump blood efficiently throughout the body. What is diastole? The heart muscles relaxes and refills with blood. It's called diastole. Systole. The heart muscles contracts and pumps the blood out. Phases with the cardiac cycle. What are the phases? Atrial and ventricular diastole. Both atria and ventricles are relaxed and filling with blood. Atrial systole. Atria contract, pushing the remaining blood into the ventricles, often referred to as the atrial kick. Ventricular systole. Ventricles contract, forcing blood into the aorta and pulmonary artery. What is the duration of these cycles? A healthy heart, human heart, typically beats around 72 times per minute, resulting in a cardiac cycle during the approximately 0.8 seconds. In essence, the cardiac cycle is the rhythmic sequence of events that allows the heart to effectively pump blood throughout the body by alternating between contraction and relaxation phases, enabling the heart to deliver oxygenated blood to the tissue and organs while simultaneously returning deoxygenated blood for oxygenating in the lungs. Oxygenation in the lungs. What is heart sound? Looked up. Heart sounds are the noises produced by the beating heart, primarily due to the closing of heart valves during the cardiac cycle. These sounds are typically described as locked up, with the lub represents the closure of the atrioventricular, that is mitral and tricuspid valves, and the dub represent the closure of the semilunar, that is aortic and pulmonary valves. Electrical changes in the heart. Electrical changes in the heart, also known as arrhythmias or heart rhythm disorders. Rhythm disorders occur when the electrical signals that coordinates the heart's beat don't function properly. This can manifest as the heart beating too fast, tachycardia, too slow, bradycardia, or irregularly. Cardiac output. What is cardiac output? Cardiac output equals the stroke volume into heart rate. Cardiac output, or how much the blood your heart can pump in a minute, can tell your healthcare provider about your heart's strength and health. This can help them make a diagnosis or find out of if your treatment is working as it should. Providers can use several methods to calculate cardiac output. Some methods are more invasive than others. What is stroke volume of the heart? Stroke volume is the amount of blood ejected from the ventricles with each cardiac cycle. It can be readily calculated by subtracting the end systolic volume from the end diastolic volume. Multiplying the stroke volume by the heart rate yields the cardiac output typically reported in liter per minute. Look at here, this formula. Cardiac output is equal to stroke volume into heart rate. That is beats per minute. So far we discussed about the heart and cardiac cycle. That is heart cardiac cycle we discussed. We have done. Please subscribe our YouTube channel.